Basi naomba kwamba gavana wetu akiwazili zote tusimame ili tumkaribishe. Nitaomba tusimame kwa heshima ili tumkaribishe gavana wetu. Basi tumkaribishe kwa makofi moja. Tena. Karibu. Gavana wetu wapi, vigelegele. Karibu sana Your Excellency. Gavana wetu, Gavana Stephen Sang, bali gavana wetu katika kaunti letu la Nandi. Basi asante sana pendi wetu. Thank you so much. Tukipaki kama tumesimama, nitaomba pendi yetu watuongoze kwa wimbo wa taifa vile ya Jumuiya ya Afrika Mashariki. Karibu sana pendi. Tukipaki jinsi hiyo, nitamkaribisha Reverend Victor by the County Chaplain atufungulie kwa sala.
Na tuombe. Everlasting and gracious Father Lord, this morning we thank you because of the gift of life. We thank you because of the blessing to your servant that is always has a good plans to each and every one of us, Father Lord. Your servant, His Excellency the Governor of Nandi, and the team of health. As we celebrate this day, your servants from the community, health workers, Father Lord, that you've called them at the right time to continue with your blessings, to continue with your ministry of healing and helping your people. May you bless each and every one of us, Father Lord, and even as we continue blessing our county and all the staff that you've given them opportunity to work and to serve your people. May your blessings, Father Lord, journey with us and start with us with your blessings in the name of God the Father, the Son, and the Holy Spirit. Amen. I will just give you a reading from a book of Philippians as you sit kindly, from the book of Philippians chapter 3 verse 12, and it says about only three things. Number one is immunization. Immunization leads to a culture which we thank our Excellency the Governor this day. While you are senator, you immunize the people of this county until they transform the blessings. And then number two is information. And when you took the first time when you were the governor of this Nandi, you passed the information to all the people across the county. And now, being the second time, you have transformed us. And that is why we have the people from the community being transformed from the health department. Bwana awabariki. Have the word immunization, information, and then transformation. God bless you.
Asante sana Chaplain wetu Reverend. Your Excellency sir, Mheshimiwa Stephen Sang, Area MCA Mheshimiwa Matata, mwenyekiti wa afya katika county assembly wetu Mheshimiwa Ezra Rotich, afisa mkuu wa afya katika kaunti letu Bwana Kiptum, directors present tukiongozwa na Daktari Bungei. Kwa ruksa yako Your Excellency, nimkaribishe chief officer wetu Bwana Kiptum, director Bungei aendeleze ratiba kuanzia pale. Karibu sana director.
Your Excellency, sir, the chair of the health committee at the assembly, MCS present, the chief officers present, directors present, wageni wengine waalikwa, CHPs oye. Asante sana. So, Your Excellency, Governor San, we are here today to properly, as an ongoing process of ensuring that our health systems are strengthened, and purposely today we are here so that we can launch the CHP kits. You can look at them, you can see them that they are in uniform, they are also carrying something with them. That is what contained therein, the kit that will enable these CHPs to continue supporting the health systems within our county Nandi. Your Excellency, sir, this program of community health services started way back, roughly around, I think, the year 2003, with the realization that service provisioned was not a preserve of the health, fixed health facilities. It was not a preserve of the hospitals. That health provision had to start somewhere at the point of the household. And at the time, we had a partner called Global Alliance for Vaccine Initiative that supported a number of counties to establish community units. At the time, there were districts. And out of that establishment, it was realized that the districts at the time that had functioning community health services performed better than the others that didn't have those community health units. And especially in terms of vaccination, initially it came in as a program to support immunization, childhood immunization programs in the districts at the time. And out of that realization, the results proved that when you can identify problems at the level of the community, in this case, the level 1, you reduce the chances of having people who will stay away from vaccination. You reduce the number of mothers who will not turn up for their antenatal care clinics. You reduce the number of complications that present to our health facilities, because in that case, the community health promoters, who are then called community health workers, were able to pick these people and were able to refer them to facilities. So along the way, of course, we've had the program of UHC, and UHC are several pillars, and the strongest pillar, I think, is the one of community health services. Community health services will anchor the program of the UHC. At the end of the day, we want to ensure that people can access quality and affordable services. But then we have to anchor this at the level 1 where these CHPs work. Community health services work within a primary health care program. These people are going to offer what we call primary health care services. And they work within what we call primary care networks. So along the way, you will still be hearing, and this is very important to the county assembly especially, that we will be asking you for more support, especially to establish what we call primary care networks. Because these CHPs work within the units that are established within the care networks within the county. So all those will require the support of all of us. So today, basically, we're here to recognize these people and be able to launch the kits that they have come with. This is just a representation of what we have in the county. In the county of Nandi, we have 1,414 community health promoters. That is just slightly more than a third of what we require to cover the whole county. Communities health promoters work within a unit, 10 of them within one unit. And for us to have adequate coverage, especially to cover the whole county, you will require more than 3,000 CHPs. That is where we hope at some point we are going to reach, because we are determined to make sure that we strengthen care at the primary level to avoid all the complications that we witness in our facilities. So I'm not going to take much time myself. I just want to request my colleagues, we work together in the Department of Health, just walk very fast to the front so that we can introduce you as a team and we move the program forward. The health workers present, whether at the management level or working, who have met to this place, working at the hospitals. Yeah, my feeling is that I would wish that Your Excellency, you hear their voices. This is the team that basically the county health management team plus a few sub-county health management team. This is the team that coordinates the delivery of health services in Nandi, including community health services. So please just say your name and the department you represent. That is what you do.
Your Excellency, all protocols observed. My name is Pris Katero. I coordinate community health services. Thank you.
Your Excellency, all protocols observed. I'm the County Public Health Officer, Alfred PG.
Excellency, and all protocols observed. Ezekiel Kisorio, County Health Records and Information Officer.
Your Excellency, Stanley Chirchir, ICTL.
I'm Daniel Gatich, Sub-County ICT Nandi East.
All protocols observed. Felix Rono, Sub-County ICT Tindred Health.
Patrick Anay is my name. I look after cancer patients at the hospital and also within the county. Thank you.
Tiparo Joshua, I coordinate mental health services for the county.
I'm John Kibet, Sub-County MOH Masopo.
I'm Dr. Kendoiwa Caroline, Sub-County MOH Haldai.
I'm Philemon Chirchir, coordinating ambulance services.
I'm Laban Talam, County Nursing Officer.
I'm Silas Lagat, Sub-County MOH Nandi.
Kembai Sale, County Primary Health Care Coordinator.
I'm Dr. Christine Chebet, Sub-County MOH, Jesume.
I'm Lillian Boyd, County Clinical Officer.
I'm Jill Samoe, County Promotion Officer.
Thank you so much. For the CHPs and probably the people who may not know me, my name is Dr. Bungei. I work as the Director for Health. Mainly, I'm the team lead in terms of technical work within the department. So I'm the technical lead. I've been leading the doctors here. Now we recruited you, you will join that team. So I'm your technical lead. The reason I'm saying that my colleagues, because you are now my colleagues, is because I ensure that services that we offer is or are of high quality. And to be of high quality, they are offered and rendered by those who are qualified. In the setup of the health workers, and I want you to take this, in the setup of the health workers, we have a rank from the lower level to the high level. Sometimes at the lower level as a doctor, you realize that something is not for you, that you have probably made a diagnosis, but then in terms of care for that patient, that does not belong to it is not within your jurisdiction to provide the service to that patient. So what they do is to make sure that that patient reaches the next level. We have brought you on board, and initially, of course, during the trainings that we had way back, you were told what to do. So many things, including what you are going to start doing, and yet you are not doing before. What is key is to ensure that you do not do what does not belong to you. The doctors in hospital, even the ones who are sometimes they recognize that a problem belongs to a certain person. So they refer that person to the next person. So please stick to your mandate. Tunasikizana? Because if you do not stick to your mandate, nimewambia I'm your technical lead. The sanctions shall not be so good. You see, We all have the same intention of ensuring that people in Nandi get the services. So if your role is to diagnose, for example, someone with elevated blood pressure, don't even tell that person that you have hypertension, because elevated blood pressure is not hypertension. So. And we shall keep on interacting and learning. If you do a blood test for sugar, and you realize that the sugar is elevated, don't tell them that you have diabetes. It is not your job to tell them that you have diabetes. Just tell them that your sugar tested seems not to be normal. It is on the higher side. I want to send you to the next level. If you do that, that is now quality work. So. You do not tell a mother that your child is malnourished, has malnutrition. That is not your job to make the diagnosis. Please do the measurement of the upper arm circumference, and the thing that for doing that is inside there. And tell the mother, mkono ya mtoto inakaa ni ndogo kuliko ile inatarajiwa, lakini sijui ni nini. So refer them to the next level for the diagnosis to be made. So. If we can all do that and stick to our mandate, I don't know, we shall have the best. So I just wanted to mention that in brief, because we don't have a lot of time. His Excellency is scheduled to attend another function, and I want to move this program forward. We will keep interacting. We'll keep interacting, interact within your networks, interact, and my office is also open. So, at this juncture, Your Excellency, allow me to recognize the partners that have worked with us to make sure that this program runs. And number one on that list, I want to recognize the presence and the representative of the Catholic Medical Mission Board to please come, and they seem to know you so much. You must have done so much for them. Please continue doing that.
His Excellency, the Governor of this noble county, Nandi County, Chief Officer of Health, Chair of the whole Health Committee at the County Assembly, the Director of Health, and all protocol observed, good morning. Good morning once again. My name is Mary Chichole, and I work for Catholic Medical Mission Board. And apologies, my team leads could not be here, but I stand in for them. Your Excellency, this organization, through the support of Global Fund and principal recipient to AMREF, Health Africa, have been in this county supporting malaria activities in the two sub-counties of Tinderet and Aldai. And we support malaria interventions in those sub-counties. We have supported 480 CHPs, and we have 48 community units together with 41 link health facilities that we work with. And this organization, once again, through Global Fund and AMREF Health Africa, we were able to support the training of community health promoters on electronic community health information system, which is ongoing in the 6 sub-counties. And we are targeting that we will be able to train all the community health promoters, some of them who are seated here today with us, on a community health information system. I want to say thank you so much for your continued support from your team in the health department, from your team at the sub-county level, and from these beautiful health community health promoters from these 6 sub-counties. Thank you so much, and God bless you.
Asante sana, wamekufurahia na wanaendelea kusema endelea kukaa na sisi. Your Excellency, what she mentioned, the Catholic Medical Mission Board, they are currently we're in the process of training these CHPs to be able to record whatever they are doing in real time, using a gadget that is being provided to these CHPs and the ones who are not here. So when they visit the household, They are not going to record anything on a piece of paper. They will just be dialing whatever they are capturing in terms of registration, and anything that probably they have done within their household, they capture it in real time, and we're able to see that. And even in Nairobi, they're able to see that in real time. Asante sana CMMB. So the next representative is AMREF. AMREF really helped us when we were trying to increase the number of CHPs. Initially, we had very few CHPs because we didn't have someone to support us. But AMREF came in and they were able to help us to train the CHPs, and that's why today we can almost comfortably say we've covered almost like a third or just slightly more than a third. It's courtesy of AMREF and the Ministry of Health. Asante, karibu sana.
His Excellency the Governor, all distinguished guests, ladies and gentlemen, all protocols observed, good morning. Good morning, our CHPs. I trust we are all well this morning. My name is Caroline Murerwa. I will give a brief overview about AMREF Health Africa. I would like to say that today is a great day to be here. I'm glad to be part of this great process. Receive our warm greetings from the Global CEO, Dr. Gidenji, our Country Director, Dr. Meshak, and the entire AMREF fraternity. AMREF Health Africa is a non-profit organization. It works in all the 47 counties. We are a health-oriented organization with our vision being lasting health change in Africa. Our mission is to transform health of the communities through primary health care, with our major focus being on women and youth. So far, we have reached 39 million people across the 47 counties with our interventions. Our work in health focuses on health policy and legislation, leadership and governance, research work and community health. Our strategy for 2023-2030 is to, some of the programs that we have include programs in malaria, programs in TB, WASH programs, reproductive health, global health security, NTDs, lab networks, among other health programs. Our strategy for 2023-2030 is to build the capacity of community health promoters so that they are able to provide quality health in the community level. We also will endeavor to optimize the capacity of the health systems to effectively manage delivery of health products and technologies in primary health care facilities. Today, I'm excited to witness the commitment of the county government of Nandi in rolling out primary health care through launching the CHP's tools of work. AMREF Health will continue partnering with Nandi County and other counties to make primary health success. Thank you very much.
Thank you so much, AMREF. Tunawaambia nini AMREF? Waendelee kubaki na sisi, ndio? Asante sana. The next, we have a representative from the Ministry of Health, Hassan. I want to ask you to make your brief remarks. With the support of the Ministry of Health, they've been able to coordinate all these activities and ensure that we are up to date in terms of what we are doing here in Nandi. Karibu, Hassan.
Your Excellency, the distinguished guest, my name is Ali Hassan. I work at the Ministry of Health as a health information specialist, and I'm a master trainer in ICHIS, the program that is being trained to the community health promoters. And whatever I wanted to say, Dr. Bungei mentioned it, and the role of the CHP is just the reporting, health education, and referral. So we expect them to do good work because the Ministry of Health emphasis is on prevention, because most of the time diseases start at the home state, and the earlier it's identified, the better for the technical part to resolve the problem. Thank you very much.
Thank you so much, the Ministry of Health, represented by Hassan. We also have a partner that has been here with us, working with the Department of Health in terms of helping us with diagnosing and screening children with hearing impairment. So I want to ask him, Steve, please come. The partner represented by Steve has helped us to do karibu. Utatuambia umetuletea nini? Nimeona maboxes ziko hapo, utatuonyesha. Oh, they are here.
Thank you, Daktari. His Excellency the Governor, we are so happy to be here today. As has been said, my name is Steve Kitur. All right. Yes, we are very happy to be here today. We represent an organization called Children's Speech and Hearing Loss Organization. We do identify children with hearing loss as young as 1 day old. So our program is supposed to come and make Nandi County the first public hospital in the country after KNH to offer early childhood hearing screening, identification, and intervention. So we were happy to be received by the county government. We've done some screening last year, and we've identified several children who need support for hearing loss. And in the developed world, hearing loss is going down. In fact, they are closing deaf schools. Apparently in our countries, we are opening more deaf schools. So we need to make Nandi County the first county that is going to identify these causes and make sure we do the relevant interventions before it gets too late. So today we are happy to bring you 3 sets of equipment. Number one is called a tympanometer. I'm sure the doctors know. The next one is called an audiometer. And the last one is called an ABR machine. ABR machine provides a service called BERA. And BERA is only available at KNH right now. And I was called by the Ministry of Health, Jana, to say the one at KNH has broken down. So they were asking if the Nandi program is already on so that they can refer all people in the country to come and be served here in Nandi. So I want my friends to show us and my friends in the US to see that the equipment has finally gotten into the hands of our governor because they are here, okay? This equipment is worth more than 10 million. And we are giving it to the lovely county of Nandi. Now, these ones are supposed to test the outer ear, the middle ear, and the inner ear in that order. So a child who is born today in Nandi County can be screened for hearing loss even soon after birth. So we want those children to be screened. And I'm happy the CHPs are here because we want you to go to every home in our county and ask them if they have had their kid screened for hearing loss. Because if we can identify them today, we can be sure that in the next 10, 15 years, we'll have fewer hearing loss cases. Thank you very much, His Excellency. I want you to stand here and let the world see that you have received this equipment. If it were possible, you need to see what they are. Of course, I'm sure the hospital will sort it. Sir, pull out this one. This one. Yes. Yes, you can open it. Open the other one as well. That is a symbol. Yes. This equipment has this one is called an Eclipse. Okay. This is almost 6 million shillings, as you see. Okay, it's very simple. It comes from Denmark, the Republic of Denmark. All these are the accessories that go with it. Once a child has been born, you can always screen them for hearing loss, and you can provide the relevant interventions as soon as possible. We have an audiology center we are setting up at the hospital, and we'll be happy to offer services. Please tell the world that Nandi County now is competing with KNH to provide hearing loss screening and intervention. So I want the governor to receive this. Hold the mic, then I can give the governor. That is an audiometer. You can pull the next one. The packaging is very complicated, but we are happy. This is the tympanometer that measures the functioning of the bead ear. So we have gone for training. I have gone to Kampala, I have gone to Rwanda, I have gone to recently South Africa, Pretoria, to see how they are doing it. And we want to train everyone here, and especially build the capacity of our people to be able to do this even here in Nandi County. Thank you very much for receiving this, Governor. We hope to continue doing more work and to bring the world to Nandi County. Now that Nandi County has offered this, I'm sure WHO will be more interested in coming here to support the county government to build the biggest facility for offering hearing support for children in our country. Thank you very much.
Mnaonaje haya maneno? Tuko sawa? But the partners tend to go to counties that are not complicated. And by complicated I mean so I was mentioning that partners tend to go to places where the working environment is not complicated. And I think that is what the county government of Nandi, led by His Excellency, our governor, is offering. That partners are feeling free to come and work in Nandi because we do not complicate the working environment. So, asante sana Steve, tell your people that we appreciate. We want to have them as many as possible. And partners talk to each other. These people who are here representing partners, they tell you that they have a discussion. They have a forum where all of them meet. And they ask, how is it to work in Nandi? Is it a place that we can be received? Is it a place that we can be, so when these people come here, they have discovered that probably the environment that is offered by the county government of Nandi is the best. So let's welcome them and ask them to keep coming and keep working with us. I think I'm almost coming towards the tail end. We also had Red Cross. Red Cross have been supporting us. Kenya Red Cross Society has been supporting us here in a number of ways. But I'm told we do not have their representative here with us. So let them know that we appreciate their work and we would wish that they continue working with us. And as I probably, before I usher in the chief officer to take over the next part of the program, I want to ask these two CHP representatives to come and make their short remarks here. So number one, Miriam Jelagat from Kapsabet, please come. And the next other person is Mr. Nyango from Chemelil. Please, let's come. Move with speed. So Miriam Jelagat, please make your remarks.
Gavana wetu, MCA, mkurugenzi mkuu wa afya na wakurugenzi wenzetu na CHP, Bwana asifiwe. Bwana asifiwe. Mnaonaje siku ya leo? Mnaonaje? Gavana wetu, tunasema asante, tunashukuru. Umbali tumetoka na mahali tumefika, tunasema ni asante. Tumekuwa tukifanya kazi mashinani bila vifaa vyetu vya kazi.
tumekuwa tukisaidia jamii, tukiwaelimisha kuhusu afya yetu, tukiwaelimisha jinsi wanavyoweza kupanga uzazi bila stakabadhi. Lakini leo tunasema asante. Tunashukuru. Tulipokuwa Kericho tulisema asante pia kwa president wetu Ruto kwa kutuletea stakabadhi hizi tutumie tukiwa CHB. Tunasema asante. Tunashukuru na tutaungana pamoja kufanya kazi tukiwa mashinani. Tutahakikisha jamii zetu zimejua kuhusu afya zao. Tunasema asante. Mbarikiwe.
Basi gavana wetu, viongozi wote, nataka niseme Bwana asifiwe. Letu kama wana afya mashinani, siku ya leo natumai ya kwamba tumekuja ni kwa sababu ya graduation. Sababu niseme ni hii: tumekuwa tukifanya voluntary work for that long, na leo tumekuja kujulisha rasmi ya kwamba tumetambulika kule mashinani. Nataka shukuru kwa hiyo sana. Pili, nataka pia nishukuru wana CHPs wote kwa huo muda ambao wamevumilia. Hizo miaka yote tumekuja tukivumilia. So leo nikisema kwamba subira hufuta nini? So nanyi mnasema nini? Gavana wetu tunawashukuru. Serikali yetu kuu pia tunawashukuru. Partners wote tunawashukuru. Letu sasa ni kuhakikisha kwamba tumepeleka ujumbe ipasavyo kule mashinani. Na tutasaidia Wizara ya Afya kuhakikisha tunaingia kila nyumba kusaidia watu wetu na kuinua afya mashinani. Mpaka hapo nasema tu asanteni. Mungu awabariki.
Asante sana. Asante sana Miriam na Mr. Nyango. One other partner that I'm told is present, the branch manager KCB Kapsabet, please. We appreciate you and we want you to learn the things that we do so that when we come with a proposal as part of your CSR, now you can support. Asante, karibu.
Thank you so much, Your Excellency of the Governor of Nandi, all guests and invited friends of Nandi County, our CHPs, good morning. Good morning once again. Yeah, I'm Justus Kibet, KCB Manager, Kapsabet branch. Mimi ni mgeni upande hii lakini niko tayari kufanya kazi na nyinyi. Governor and your government, on behalf of the bank, I wanted to assure you that you will have a partner in us. And in this exercise, I'm giving an assurance that whenever you are making payments, the county government will save money. We will support you in this, and even the bank leadership will also be doing something next year probably, so that we can all support our health care programs and support both the national government and the county government. Kwanza mahali sisi tuko hapa, they must feel that we are there. Sisi si wale wa kukua tu tunaomba tupe account and we are not doing anything. We are guaranteeing you that we will work together in this journey. We will identify some dispensaries that we will also be supporting. So otherwise, thank you so much for the great welcome. I've come with my colleagues, the branch manager from Nandi Hills, my sister Federesi, you can just stand and wave, our colleague from the regional office. So that tells you that from the leadership of the bank, we are all together in this. Otherwise, today is not our day. We wanted to wish the county government success in everything they are doing, and also you CHPs. Well done so far, and keep up the good work. Tuko pamoja.
Asante sana Bwana Kibet. So In my closing remarks, I want to say this. We will support you. We will support you. My office, I'm sure the whole county government is ready to embrace you so that you can help us. But two things. Please do not be tempted to do a prescription. You're going to be quacks. You see, so you know there are people called quacks. It means they are not qualified, but because they have been hanging around hospitals or hanging around where drugs are stored, they think they can become, yes, they can prescribe. You know, drugs can be so dangerous. And you cannot realize that, you may not realize that until that day when you run into a problem with it. Number two, please do not be tempted to sell the service you're offering. Nanisikiza? Please do not be tempted to do what? To sell the service that you're offering. Let's work together. We'll support you to make sure that you are helping us. So that at the end of the day, at least the health indicators in Nandi can actually go up. With those many remarks, allow me to usher in the chief officer so that he can take over the program from there. Karibu, Bwana Chief Officer.
Thank you so much, Daktari. Your Excellency, sir, the Governor of Nandi, Stephen Sang, Chair, Health Committee, Honorable Ezra, Area MCA, Honorable Matata, ambaye hana matata, our team and my colleagues, our partners, and the guests of today. Good morning. Tusalamiane hewani. Thank you so much. So, CHPs, this is your day. Can we say so? This is our day. This is our day. Your Excellency, this is an army. This is an army, Your Excellency, who are ready to combat disease and prevent at the ground level. They are trained. You see, they are kitted. They have uniforms. The boots are ready on the ground. Courtesy of this team, Your Excellency, we've managed to improve indicators, and more so in nutrition. In 2019, we had a standing which stood at 30%. And courtesy of this team, we did community reach out, and as of now, we've reduced to 15. So they are playing a critical role in reaching out to the community and to CHPs as you go to the ground to carry out your duties. Let us improve on areas that we've earlier indicated. There is a low turn up of our mothers to antenatal care in the first trimester. As you move from house to house, kindly ensure that all our mothers attend clinics or antenatal visit in their first trimesters so that we can offer services to those mothers. Otherwise, Your Excellency, I'm assuring you, we've trained these people. You'll find a mother who is 50 years old, but she is a tech savvy. All of them are trained to use the gadget that we've distributed. All of them are trained to use whatever they have in that kit. So to the CHPs, you are a wonderful team to us. As Dr. has said, in health, all of us know the role they play. Your Excellency, in health, sisi wote ni madaktari. All of us are doctors in health. Whether you are a CHP or a nurse or what, all of us are pharmacists. There is a doctor who does the surgery, those are the surgeons. And there are these doctors who do community work. So all of us, we are doctors doing different roles. Your Excellency, we are happy as a health family. We are working together and we are happy that you've supported us this far.
The time. Bwana Yesu asifiwe. Asante sana. Your Excellency, I think I'm the happiest person because this program has been launched in government. I also want to extend my gratitude to the partners and especially the team from the USA that have actually had that you will be the smartest. Ama namna gani? So hiyo ndio changamoto ninawapatia. Tufanyeni hii kazi, tusaidie wananchi wetu wa Nandi County.
Wacha tuwasalimiane tena. Bwana Yesu asifiwe. Najua sasa madaktari wameongea hapa na wajatoa moto ya watu. Afya yetu, ngozi wa idara ya health kule assembly. Nimekuja kwa niaba ya assembly nzima. Tuwapatie baraka, tuwapatie heri njema ili mtakapo wametoka mbali. Hao watu wamekuwa volunteers for the last 20 or 15 years. Mjipigie makofi iliyopita. Na ni nyinyi ndio mtaendeleza kazi hiyo, kwa sababu serikali ya Kenya Kwanza na gavana wetu wako na mipango ya kuhakikisha kwamba wanakuja hospitali, wale watu ambao wanakuja dispensary, wale watu wanakuja health center, ugonjwa yao imetoka mahali. Si namna hiyo? Unapata mtu amekuwa akiumwa na pressure, waje tupime sukari. Na nimependa daktari director amesema vizuri, sio wewe kumwambia hii kichwa yako inaumwa inaletwa na hii. Wewe tu, sisi kama committee, sisi kama assembly tutahakikisha hiyo kitu imekuwa factored in our budget. Si namna hiyo? Na governor na chief officer after sisi tume
Aya, tuketi tafadhali.
Bashukuru nyinyi community health promoters wetu ambao mmefanya kazi kwa bidii, kwa kujitolea bila malipo kwa zaidi ya miaka mingi ambao mmefanya kazi. Part of community health volunteer. Wazazi wetu walisaidiwa na community health volunteers. Hao wa miaka 50 hao babu 20, 25 mpaka 30, piga hao makofi. Sisi kama serikali na mimi kama community health promoters means we are actually getting the universal health care right. Hii maneno tumejaribu hapa Nandi for example. Ni infrastructure. The level of infrastructure in our health facilities was down. Tukaanza maneno ya kufanya ujenzi. Ukienda katika hospital ambayo karibu tunaikamilisha hapa Kapsabet. Ukienda Kabinet kuna kazi kubwa tulifanya. Ukienda kule Chepterwoi, we are doing a very big hospital. It is almost straight from a container to a level 3 facility. Palliative. Ukienda kule Tinderet, Maraba, we have done huge investment around Maraba, including a new. Kama ungeenda katika mahospitali zetu, the level of equipping was low. Hapa Kapsabet County Referral Hospital, watu wetu walikuwa wanaenda referral kwenda kutafuta sukuma mambo. Hapa Kapsabet tulikuwa na theater moja, now we have 2 theaters. Nandi Hills we had only 1 theater, now we have 2 theaters that are operational. We also had a challenge in equipping our facilities. Right from the complicated equipments like the MRI and the CT scan diagnostics equipment, all the way down to even katika ya kuongeza wafanyikazi wa serikali katika sekta ya health. Wakati mimi niliingia, for example, 1 cadre ya clinical officers, we had only nurses, is the same for dentists, is the same for, all those cadres to may increase our staff. Even with that increase in staff, maneno ya drugs, maneno ya non-farms, maneno ya all the commodities in our hospitals. We have done an increase in our commodity supply to our hospitals. Budget yetu wakati mimi niliingia to our facilities. We used to do an average of 650,000 patients across all our facilities in 1 year. About 650,000 patients. If mgonjwa afike kwa hospitali, that is where you lose it. You must find a way of going to the community and preventing those issues, health issues within the community. What is the problem within our communities? A very good example, and I'm hoping that this team will also be trained around issues of nutrition. It is a shocker. I got to know the other day that some families in 2023 still don't have, for example, toilets in their head. As we speak, all the families in that parish wote wamejenga toilets. We thought it was a joke in our facilities if we can sort out at that level. Who are going to help us do this? Yourselves. So nimesikia rafiki yangu Dr. Bungei and issues that did not need to come to our facilities. Na mimi nataka kuomba mkono wenu tusaidiane. Now that you guys have been doing it free of charge, you have been doing it as a volunteer, you have been doing it without facilitation, you have been doing good into equipment, and we ensure that those resources are invested at the local level where you as community health promoters are. So that in another 1 or 2 years, when counties are ranked, I want the indicators of Nandi County to be at the top of it. Tuisukume kabisa mpaka ijulikane kuna kazi imefanyika kule Nandi. And with every ward, tuende kwa every constituency, all the way to every, at the county level, let us give ourselves, in the next 1 year, we do a proper assessment. Now, I want us to work on a proper reward scheme that is going to give you a lot of interest. Yule anafanya kazi, maneno yake. This is November. Next year, around this time, tuko na dina kubwa where we will be rewarding. And the reward is not just going to be for you upewe kikombe na certificate and nini, no. It has to, I want you to know that you stand a chance to be recognized for the good work that you are doing. And when you are recognized for the good, our county are properly rewarded, they are supported so that we can work together going into the future. So mimi nataka kuambia, mimi niko na nyinyi huko Homa Bay. The same kwak alikuwa amepewa sijui amekuwa sergeant mkubwa kule Homa Bay, alikuwa ametoka Siaya, we discovered him in Nandi. You know, it is, we still credit Nandi for discovering the CHPs or CHVs. Kweli ama si kweli? So hii madaktari wanafinya nyinyi na nyinyi mmekuwa mkifanya hii kazi miaka 50, miaka community. When you had not been even, you know, there were no regular training for you. You didn't have equipment. Nobody recognized you. You didn't have small stipend. You are working purely. Hata ile ya kusema, you know, msichukue kitu kutoka. The health indicators in Nandi is going to change. Sio hiyo jameni. So as you get started today, Stephen Kituri and the team, we want to tell you thank you so much. Ndugu yangu kuja hapa. Umesikia leo, we are getting this equipment for testing, screening, and supporting our children, identifying those cases of hearing loss at an early stage. The challenges that we face in our country today is that diagnostics come too late in the day. And when the diagnostics come late in the day, it, you know, it's limited. The extent to which you can change those things become limited. If it is identified early, including Bwana Kenai, wapi Kenai hapa? Kenai, you are kuja hapa. You are handling cancer patients yourself. A lot of the cancer cases in Kenya today and in the world globally, if they are discovered at stage 1, even at stage 2, there is very high chance that you can actually treat it for, and it is done for good. But what happens? Most of our patients are discovered at stage 3, stage 4. At that level, it is too late to change anything. Unangangana, it is very expensive to treat, and it is also the chances of somebody getting out of it, being treated completely and healing, are very limited. But if we discover early at stage 1, we have a very high chance. So what you people are going to do, you are at the base, you are at the community, to help us identify those issues. I am hoping that even cases of breast cancer, you know, we should be able to build their capacity to help our mothers at that level. If a mother can actually be trained to do the, what do you call it? Breast examination on their own. How about these wonderful people who have already gone through some training? So we should be able, I want us to really use, you know, Bwana Kenai and your department on cancer, you know, cancer treatment, and the cancer department section, oncology. You also have to work, you know, these people are available to be trained to support us in many other areas, including cancer, including nutrition, the team under nutrition. This is the team to use. While wengine, all those things, including this, I don't know how we're doing here, the vaccination, what do you call that? HPV vaccination. The people to help us mobilize the girls and the community at the lower level. So I want to, you people sit down now. You have a battalion of soldiers that can help you sort out all your problems, so that we reach out to the community and ensure that we utilize the resource that we now have from this wonderful team. So Bwana Kenai, tumia hii watu. Bwana Kituru, we want to thank you in a very special way. That you are one, hii process yote Kituru amefanya, he started this journey as a parent. A parent who had a child that had the same challenge. And from it, hakusema tu wacha nisaidie mtoto wangu, amesema wacha nisaidie watoto wa Nandi, wacha nisaidie watoto wa Kenya. As you rightly hear, hii equipment tumepewa leo hapa. Part of that equipment, there are only 2 in Kenya today. Moja in Kenyatta National Hospital, the next one and brand new hapa Kapsabet. Na tunaombea Mungu watu wa Kenyatta National Hospital because yao that's okay. Hiyo yao sasa imepata shida juzi. Sasa hapa Kapsabet wanasema mumeanza kutumia hiyo kitu tutume. Kwanza initially I had to work hard to convince him not to be waylaid hapa katikati, wachukue Kenyatta kwanza waanze kutumia Kenyatta, saa zile bado wanaunda yao. So as we speak, we have a good opportunity. Ninyi mkienda katika hizo manyumba mnatembea, utapata mtoto mdogo, unaona kidogo there is a challenge, pengine hako na shida na kusikia hearing. Now you know, huyo amuta sukuma yeye aende kwa dispensary ya village, unamwambia akimbia wapi? Kapsabet County Referral Hospital for proper screening, so that mtoto huyo asaidiwe in good time. I want to thank you in a special way, Bwana Kituru, for the partnership that we have had with you. You are such a rare gem for us. And thank you for the heart that you have to support children, not just your own children, and not just the children of Nandi, but the children of Kenya. So hii maneno, hii equipment itasetiwa hapa, you do whatever you need to do. Once we are done, already the officers from the Ministry of Health in Nairobi wamesema wao ndio watakuja kusaidia sisi kulaunch hii program hapa Kapsabet. And since this is going to be the second after Kenyatta National Hospital, this is big for us. And we thank God, and you and the friends and the partners that you are working with in the US. Sisi tunataka kuwashukuru sana. So that this journey we will work together. Whatever resources that is needed from county government of Nandi, tutaweka hiyo resources. Asante sana ndugu yangu, and thank you for the support that you have given us today and the support that you have given us over the years. We started this journey almost 4 years ago, and we are still on that course. So asante sana. Tumpigie Kituru makofi. So asante. You can have your seat. So nyinyi ndio wenyewe. Hakuna watu wengine wa kuangaliwa. I think for me, nimefanya na nitamaliza maneno ya kujenga hospitali, nitaongeza staff, nitaongeza equipment. I will continue adding the budget for medical supplies. But there is one component that I have to invest heavily, because I have realized that as you deal with the four, if you cannot sort out at the basic community, you will still have a problem. We have to deal with the health matters at the community. And you are the soldiers that will help us. We thank you for the free services. We thank you for the volunteership that you have given us, but we are going to stand with you. We will support you. We have started with that stipend. Tunangojea national government watupatie ile yao the 50%. We have already set aside our 50% so that we can be able to support you as we have agreed. Sisi tumekubaliana jameni. And now as we commission you today, ninyi mnajua mtu akipewa kazi formal lazima anakula kiapo. Si ndio hiyo? Mtu akipewa kazi formal, ile kazi formal lazima akule kiapo. Na nyinyi leo mimi nitawakulisha kiapo. So this is the set of equipment. Hebu tuambie hii boxes nyekundu hii watu wanabeba iko nini ndani na ni ya kufanya nini na ni ya kuelekea wapi.
Asante sana, Your Excellency. Allow me niwaonyeshe what is contained in the CHP kit. So nitainua mkiona hiyo no ya kupima kilo kwa watoto, baby weighing scale. Umeona? Alafu ukishapima mtoto lazima...
So kabla ya kupewa hii walikuwa wanapimia nini? Walikuwa wanashika hivyo, unaona hii. Hey.
So another one,
mmefanyisha hii watu kazi kubwa sana.
The next one ni kilo ya mtu mzima. So uko na ya mtoto na uko ya baba na mama na ndugu zake na ndugu za mtoto. The next one tuko na hii ni ya kupima sukari. Mtu kuna maswali mtauliza, ikionekana anaelekea nikaa sukari inaweza iko juu, kuna vile mtafunzwa to decide. Sio kila mtu, kuna watu mtapima.
Hiyo ni pressure ama ni sukari?
Oh, sorry. Yes, blood pressure machine. Yeah. So blood pressure hii ni ya kupima kila mtu. Yenye nimesema ni ya sukari, njoi. Pia labda niseme pia mtafunzwa vile ya kutumia. Msitumie kama hujajua, sababu iko na procedure vile ya kufanya, ni ya sukari. Alafu tuko na first aid kit. Unaweza fika, kuna ajali imefanyika nyumbani, kuna mtu amejikata na jembe, panga, kuna vitu ya kutumia ili kumsaidia huyo mtu ndio uweze kumrifa kwa hospitali.
Hiyo wanatibu hiyo.
Hii ni first aid. First aid ni sana sana kusimamisha damu kumwagika. Okay. Kusimamisha tu damu kumwagika, ndio first aid. Hey. Alafu kuna box.
Madaktari wanatufinya sana.
Hii ni ya dawa. Hii ni ya kubebea. Kutakuwa na a few things. Kama mtoto ambaye anahara, mtapewa vitu kama zinc ORS. Ndio hii kitu ya kubebea.
Unasikia wanajua hata kabla hujasema. Hiyo watu ni hatari hao, wamefanya kazi hiyo.
Alafu sasa zile tunaenda pia mashinani, kuna chenye inaitwa infection prevention, kuzuia kuambukiza wagonjwa wakati unahudumia. So wakati unapima sukari, kuna venye utaweka shindano ya kupimia sukari, lakini tumesema mpaka trainiwe, mfunzwe vile ya kutumia. Alafu hii ni ya maji, ni ya refreshment. Sasa zile unatembea, tunajua venye mtatembea kilometers mingi. Hii unaweza bebea maji ama unaweza bebea chai. Sababu hatutaki wananchi wahangaike pia kutafutia chakula sana, utakuwa umebeba chai yako. Alafu pia kuna torch. Hii torch ni ya vitu mbili. Unaweza tembea, by the way, ikuwe usiku, utumie kuangalia njia ukirudi nyumbani. Pia mtu anaweza kuambia niko na shida kwa mdomo ndani, unataka kuangalia, unaweza mulika hapo kwa mdomo ndani ama hapo kwa masikio uweze kuona ndani. Alafu sasa kabla ya hiyo vitu yote kuna simu. Hii sasa simu ni ya kuregister the household, na pia itakuwa na procedure vile unaingisha information, na hata maswali zenye utauliza iko kwa hii simu. Hata kama ni kurifa, itakwambia what to do sasa zile umeregister na umeidentify the household.
Iko na WhatsApp na
WhatsApp.
Hata ka TikTok hivi inaweza saidia ama?
Hii ni simu kawaida. It is simu Neon Ray Ultra ya Safaricom. Iko na all features ya smartphone, lakini kwa sababu hii ni kifaa cha kazi, tumeweka tunaitanga dunga. Yes, ikuwe kifaa cha kazi, isikuwe na msitumie kwa maneno mengine. Sawa sawa. Asante.
Hii watu ya 50 unafikiria hata TikTok wanajua watatumia kwa kazi.
Pia kuna name tag. Sasa ile unatembea huko unajulikana. Unawekewa mpaka name tag hapo.
Na hiyo wako nayo hiyo reflector.
Pia wako na reflector. Siku nyingi mmelia sana maneno ya identification. Mkitembea huko vijijini hamjulikani, lakini kutoka leo mmejulikana. Yes. Pia kuna thermometer ya kupima temperature. Iko ndani ya first aid kit. So ukifika na unaona ni kama mtoto ako na joto ama mtu ni mgonjwa na ako na joto, unaweza kupima pia temperature. Na kwa hiyo system, najua kuna wale wametrain itches. Si mmetrain? Mmeambiwa jinsi ya kutumia. Ukiingiza temperature ndani ya hiyo system yenye umeona, kwa hiyo system inakuambia what to do. Either inakuambia refer ama inakuambia aje iko sawa, si ndio? Sawa sawa.
Sasa mnasema na kumbe hii watu wanajua maneno. Unasikia wanauliza iko nini, iko nini. Hata mnasema mnataka nini?
Kuna pia MWACTEP, lakini kwa sasa haiko ndani ya kit, but sitaletwa. Sitakuja. MWACTEP ni ya kupima malnutrition. Yes.
Ile ilikuwa inasemekana usiseme ni marasmi kama ni nini. Sema tu ni fupi, ni kubwa, ni.
Yes, ndio sasa. Sawa.
So hii challenge, unajua you guys in the villages hapa, we are now facing, around the space of in nutrition. One of the challenges to connect in our communities today is obesity. You know that is a major challenge. Sasa hiyo team ndio itasaidia ama ni gani? That is part of the weighing scale na hiyo mwaka ndio itasaidia. Iko ndani. Hebu kuja onyesha sisi nani sasa hapo. Hebu tuonyeshe na yenu, anybody who has his or has there. Wapi hiyo, nani yako na yake? Hala. So mwana ile maneno Bongea alikuwa anasema nyinyi mnaingia kwa ile kazi ambayo sio yenu, wenyewe wanajua. Nyinyi hiyo. Very good. Wenyewe wamepata tools yao na wanaelewa tools yao ni gani na gani inasaidia. Very good. What is that other one? Ya kufunga. So can we have 3, 4, 5 of you just around here? Sasa ndio official picture welcome you.
Your Excellency, we have a representation from all the sub-counties. Six. Yes. Let me call upon Eunice Cheboti, Tinderet, Gilbert Ruto, Alai, Catherine Jelakat Mbwen, Irene Jebel Mosov, Kiprotich Augustine Chesumei, and Willie Kibet Nandi Hills. Yes.
Yeah.
Eunice Cheboti, Tinderet. Tupige makofi. Thank you. Gilbert Ruto, Alai, plus the phone. Eunice. Gilbert Ruto, Alai, plus the phone. Thank you, tumpige makofi. Thank you. Catherine Chelagat Mbwen. Tuwapige makofi. Thank you. Irene Jebet Mosop. Tuwapige makofi. Thank you. Kiprotich Augustine Chesumei. Tuwapige makofi. Alafu mzee wa kazi Willy Kibet, Nandi Hills. So, tupige makofi. Thank you. So at this point, we would like to welcome His Excellency to commission our CHPs. We would request that you be upstanding as you take the oath. Tusimame wote ili tukue commission by His Excellency. Tutafuata maagizo ama tutasema nyuma ya governor.
A few of you, mimi sasa watu hapa na nguo yao wengine hapa. Kujeni wale walikuwa, yeah, let's just come hapa tu wachache.
Sio kitu. Kila mtu na baki yake.
Bado msonge mbele kidogo. Haya. Hao wametosha. So tumesema kazi ikiwa serious lazima unakula kiapo. Ndio hiyo. Na hii kiapo ni kila kiapo ambayo inatumika Kenya mzima. All your colleagues across the 47 counties are taking this oath as a commitment to support our community. Na mtasema nyuma yangu. Sisi tunaahidi kutumikia jamii zetu kwa mioyo thabiti, mikono wazi, ujuzi na kwa kujitolea. Lengo letu ni kuelimisha, kuwezesha na kusaidia jamii zetu kukuza afya, kuzuia magonjwa na kuwaelekeza katika huduma za afya. Tunakubali jukumu hili tukufu na tuko tayari kutumikia jamii zote. Afya yetu, jukumu letu. Ndio. Mungu tusaidie. Basi. Thank you so much. Tupige makofi. Kazi yenu imeanza rasmi siku ya leo. Mimi nawashukuru kwa niaba ya serikali, kwa niaba ya president wetu, kwa niaba ya serikali ya Kenya Kwanza, na zaidi ya hiyo kwa niaba ya wananchi wangu wa Nandi ambao mmekuwa mkiwatumikia kwa miaka hiyo yote. Tuende kazi, tukutane next year tunapokuja kucelebrate 1 year ya implementation ya kazi yetu. Training itaendelea kutokea kwa Ministry of Department ya Health ili kila kitu ikuwe wazi kwenu. Lakini tunajua mimi nimeconfirm siku ya leo hata hiyo training ni ya kupiga nyinyi jeki tu. Lakini tayari nyinyi Mungu sawa ni refresher, si ndio? Tumekubaliana kwamba ni refresher. Alafu hebu tupige hiyo picha naambiwa
partners, can you join us as we take the photo?
tunapoketi, mimi nataka kushukuru as pigawa makofi wewe na hii watu ya media, hakikisha picha mzuri ya kila mtu inaonekana. Si ati ile wamesimama tu hapa maneno ya hawa. I want to thank you in a special way, our county assembly, Mheshimiwa Matata na Mheshimiwa Ezra. Tumesaidiana na nyinyi katika FIF bill, tumesaidiana na nyinyi katika budget. I want to thank you in a special way for the work that we have done for this to be possible. Ukienda kaunti zingine kulikuwa na mkorogano kidogo, mpaka wale community health promoters ambao wamekuwa kwa kazi wao wakaekwa kando, wengine wapi wakaletwa kwa sababu MCAs walikoroga process. I want to thank you in a special way that you allowed us to continue working with the team who have been working with us. Tunawashukuru sana. Wale wengine ambao wengine hawakuingia kwa team, as we grow, as we continue getting more resources, every financial year tutakuwa tukiongeza mpaka tuhakikishe tumefikia ile idadi ambayo tunahitaji. I want to thank our partners in a special way. Our partners, Kitur and your team on this equipment, we want to thank you in a special way. We look forward, we will say more when we will be commissioning the facility, but thank you from the bottom of our hearts. Wale ambao wametusaidia AMREF, Catholic missions, medical missions, the team from AMREF, we want to thank you in a special way. This would not have been possible, the training that you have been doing, and even before the government, the national government and the county government came in to support these wonderful people, you as our partners were already working with them in a very special way from the bottom of our hearts as a tenisa. I am sure the journey to working together has started to the Sukuma Kazi Pamoja. Thank you so much. Ministry of Health, Nairobi, you are our biggest supporters and the partners in this journey. Tunawashukuru sana, the training, the support that you have given us, lakini tunaona sasa wameanza kazi, so ile 50% yenyu hebu tukoroge haraka ikue, so that these people can start. 1 month ikiisha wanataka mshahara. Let us work together, but thank you so much to the ministry for the wonderful work that we are continuing to work together. Asanteni sana. Mimi sitaki kusema mingi kushinda hapo, na washukuru, Mungu awabariki. Asanteni sana.
Thank you so much, Your Excellency. Ningependa tumpigie makofi gavana wetu, makofi manne ya kilo moja, 2, 3. Asante kwa kukomesha hawa CMPs wetu. So kwa sasa tumefika kilele ama kikomo wa program yetu. Ningependa mwalike Bishop wetu, Bishop Chumba, AIC Kenya, Nandi area, aweze kutubariki na afunge kwa maombi.
Basi wakati askofu anapokuja tafadhali CHPs mtapaki, nimeambiwa mtapaki baadaye.
Halo, nionyeshe kwa mikono. Sitakuwa na mengi kwa sababu mkubwa amenena na amesema mambo mengi. Kwa niaba ya wakaaji wa sehemu hii yote tunasema partners, pongezi na tunashukuru. Wakaaji wa hapa Nandi, nataka niwapongeze kwa kujitolea kwa hii kazi muhimu katika afya ya watu wetu. Nafikiri kuzuia ni bora kuliko, so nafikiri hiyo ni jambo nzuri. Jambo lingine ni kwamba nitaomba mbele ya mkubwa wetu kwamba jambo ambalo hauliwezi vifaa, shida ni kwamba wakati mwingine tunaweza kuzuia mtu asiweze kusaidika kwa sababu pengine tunafikiria tuna uwezo huo, lakini jambo nzuri kwa kama namwambia His Excellency the President, kama wakaaji wa Nandi na mimi kama kiongozi kati ya viongozi wa kanisa hapa Nandi, kwamba tunashukuru kwa jambo hili. I think jambo hili limekuja kwa wakati wake. Kuna watu wengi ambao wanaumia, na kama wangesaidika mapema tungeepuka mambo mengi. So tutasimama, alafu tuombe, alafu niwabarikishe ili kwamba baraka hii iweze kufika manyumbani mwenu, na kila mahali mtakapoenda hiyo mikono yenu yeyote ambaye mtakugusa awe ameponywa. Sina namna hiyo. Baba, katika jina la Bwana Yesu Kristo tunashukuru kwa kila jambo. Asante kwa wadhamini ambao walitusaidia, na pia wazo hili la kuweza kutembelea katika vijiji vyetu na kusaidia watu wetu ambao wanaugua maradhi tofauti. Mungu wetu, tunaomba kwamba kwa uwezo wako mikono ya hawa ndugu zetu, miguu zao, hata na kunena kwao kuwe ni jambo ambalo linaleta uponyaji kufikia watu wetu katika mashinani. Mungu wetu, tuwabarikisha wote. Tazama unapoondoka sasa kuanza kazi hii kazi iweze kuwa ni kazi ya baraka. Nimeweka mikononi wako katika jina la Mungu Baba, Mwana na Roho Mtakatifu. Amen. Asanteni.